now we're going to start the muscles of the gluteal region. So the muscles of the gluteus region, the main muscle is the gluteus maximus. We already know that. So you can see that's why they are underlined. So actually we cut the gluteus maximus, then only we can see all these inner muscles. So the next main muscle comes the gluteus minimus, and after that comes the gluteus medius. You can see the cut end of gluteus medius here. So the gluteus maximus, medius, minimus, and also the piriformis muscle and the superior and inferior gemelli. You can see the superior and inferior gemelli, and also the obturator internus muscle, the obturator internus, this one. And you have the obturator externus muscle here, this one. Okay, and we also have the Quadratus Femoris muscle, this one. So all these muscles are the muscles of the gluteal region. So also the Tensor Fasciae lata lies on the lateral side of the thigh. So on the lateral side, this is the medial side of the thigh, right? So this is the lateral side. On the lateral side of the thigh, you will have the Tensor Fasciae lata. All these are together forming the thigh muscles just in front of gluteal region. So attachments and nerve supply, everything we'll discuss them. So what is the main action of the muscle of gluteal region? We are having these muscles. The action, the 10 muscles of the gluteal region form only 3 functional groups. That is the Gluteus Maximus is the chief extensor of the thigh. So the chief extensor of the thigh is the Gluteus Maximus muscle. Okay, it's a chief extensor of the thigh, especially at the rate of the hip joint, and this action is very important in rising from sitting position. So whenever you are sitting, you want to stand up, mainly because of the Gluteus Maximus muscle, because of its extensive action, you are able to rise, okay, from sitting position. So it is also essential for maintaining the erect posture, and other actions are, it is also useful for lateral rotation, means bringing the thigh away from the medial axis, okay, lateral rotation. And also it is useful for the abduction of the thigh. Abduction means away from the medial side, okay. And along with the tensor fascia lata, the muscle stabilizes knee joint and also the iliotibial tract. So what is iliotibial tract? Everything we'll discuss in the next slide in the diagram, okay. So it supports both hip, knee when these joints are slightly flexed. It's an anti-gravity muscle. What we are talking about, anti-gravity muscle, that is our gluteus maximus, okay. And this all show how to test the muscle, and it is done by extending the thigh. You can test this gluteus maximus muscle when you extend the thigh, then you can palpate the muscle, okay. So now coming to gluteus medius and minimus, they are also powerful abductors of the thigh. Their anterior fibers are also medial rotators. However, their most important action is maintain balance of body when opposite foot is off the ground. For example, if you lift your foot on opposite side, then this side it should be balanced, mainly because of the gluteus medius and minimus, okay. Or whenever you are running, walking, everything, they do this by preventing the opposite side of pelvis from tilting downwards under influence of gravity. So you will see in the next diagram how to test the gluteus medius, and it is mainly done by abducting the thigh. So if you abduct the thigh against the resistance, then you can palpate the contracting muscle, that is nothing but the gluteus medius and minimus. These muscles can be palpated like that. How can you palpate the gluteus maximus? Just by extending the thigh, okay. So this is the extended position of the thigh. If you extend the thigh, you can just easily, touch the gluteus maximus or palpate it. And when you are abducting it, then you can feel the gluteus minimus and medius, okay. Now next coming to piriformis muscle. So this is like just a small introduction to this each of the muscle. So now coming to piriformis, you can see here this one, okay. So piriformis is a and piriformis, noddle piriformis, and you also have the inferior, superior gemelli. You can see superior gemelli, inferior gemelli. You can see obturator internus, externus, okay. And also Quadratus Femoris, all fall into one group. So as we said, groups, till now we have discussed gluteus maximus having a separate group, gluteus minimus and medius under one group, and all these remaining muscles are under one group as their actions, according to their actions. They are all lateral, they are all the lateral rotators of thigh, hence they are in the same group. If you say the gluteus medius and minimus, they are all the medial rotators, right? Whereas if you see gluteus maximus, it is an extensor of the thigh. And now if you discuss all these different muscles, these are all the rotators, actually lateral rotators of the thigh. So tensor fasciae lata is an abductor and medial rotator of thigh, and an extensor of knee. So about tensor fasciae lata, I will show another diagram. So this diagram shows, it's mentioned in blue line underdrawn is, you can see the Tensor Fasciae. So this is mainly a abductor, means it is moving the leg away from the medial side, and it's also a medial rotator of the thigh and an extensor of the knee joint. It's an extensor for knee joint. Okay, now let us start the origin, insertion and now supply and action of these muscles, and especially for the gluteus maximus, medius and minimus, there are also some structures which are below it. Let us discuss them also. So let's start with gluteus maximus muscle. Actually this is the cut end of the gluteus maximus muscle. Okay, this will cover whole of the buttock, the back side, the fatty area, that is mainly because of the gluteus maximus muscle. So it is a large quadrangular powerful muscle covering mainly posterior surface of pelvis. So its origin is from the outer slope of dorsal segment of iliac crest. You can see this is the iliac crest. So its outer slope, dorsal segment, from there it will get origin, and also from the posterior gluteal line, and also from posterior part of gluteal surface of ilium behind the posterior gluteal line, and also from the aponeurosis of erector spinae, and from the dorsal surface of lower part of sacrum. So in the dorsal surface lower part of sacrum, you can see this is the sacrum bone. So on its dorsal surface lower part also there is origin, and also side of coccyx, you can see this is the coccyx. So from the side of coccyx, and also from sacrotuberous ligament, and from the fascia which is covering the gluteus maximus. So you can see total it has 8 points of origin. So from the iliac crest it is coming downward, from the sacrum, from the coccyx, okay, from the gluteal surface of ilium, from the aponeurosis of erector spinae, from the sacrotuberous ligament, and from the fascia covering gluteus maximus. So total 8 points of origin for the gluteus maximus. And now we'll see the insertion. So it is coming like this, and where it will get inserted, you can see here this is a cut end. So actually it is getting it insertion into the deep fibers of lower part of muscle are inserted into the gluteal tuberosity. In the femur bone you have the gluteal tuberosity, there they will go and get inserted, and also the greater part of the muscle is inserted into iliotibial tract. So you can see here this is the iliotibial tract. In the name itself you can see iliotibial tract is nothing but it is coming from the iliacus muscle, that side to the tibial side. So that is the iliotibial tract. So it will attach to that and also to the gluteal tuberosity. So this is about gluteus maximus, origin and insertion. Okay, so what is a nerve supply? This is supplied by inferior gluteal nerve. So remember, gluteus maximus supplied by inferior gluteal nerve, and its nerve root value is L5 S1 S2. Okay, so this is about gluteus maximus. You can say in short form it is coming from iliac crest, from the sacrum, from the coccyx, and getting inserted into the gluteal tuberosity of the femur and also to the iliotibial tract, and it is supplied by the inferior gluteal nerve. Now let us understand what are the structures which are inside the gluteus maximum. Of course you can see now we have cut the gluteus maximum, and inside you are seeing many muscles, right? So total there are 9 muscles inside the gluteus maximus, that is the gluteus medius. Of course you can see the gluteus medius, next you can see the gluteus minimus, next you can see the reflected head of rectus femoris. Here in this diagram it's not shown, but the reflected head of rectus femoris, you can see that. And you can also see the obturator internus muscle, piriformis muscle. Okay, this is piriformis, this is obturator internus, and you can see the quadratus femoris, and you can see the obturator externus, and also you can see the origin of 4 hamstring muscles from ischial tuberosity, and there is also insertion of upper or pubic fibers of adductor magnus. So actually all those diagrams are not here. You can see adductor group, adductor magnus. So all these different kinds of muscles are inside the gluteus maximus. So total, remember, there are 9 muscles inside the gluteus maximus. Once again let us revise. Very easy. First one, medius, gluteus medius, gluteus minimus, of course we know, and reflected head of rectus femoris, which is a part of quadriceps femoris, right? And you have the piriformis, and you have the obturator internus with the 2 gemelli, and you also have quadratus femoris. You have obturator externus, and also 4 hamstring muscles, and insertion of adductor magnus. So coming to the vessels, if you remove the gluteus maximus, what vessels? Total 7 vessels are inside. What are those 7 vessels? One is the superior gluteal vessel, another one is inferior gluteal vessel, one is the internal pudendal vessel, one is the ascending branch of medial circumflex femoral artery, one is the trochanteric anastomosis, which is formed by descending branch of superior gluteal artery and the ascending branch of medial and lateral femoral circumflex arteries, and often inferior gluteal artery. And you will see the cruciate anastomosis, which is formed by the transverse branches of medial and lateral circumflex femoral arteries and by the descending branch of inferior gluteal artery. And you will see the ascending branch of first perforating artery and the first perforating artery itself. So like many vessels are inside the gluteus maximus muscle. So just remember superior gluteal vessels, inferior gluteal vessels, internal pudendal vessels. So let us revise the vessels which are under the gluteus maximus. One is the superior gluteal, inferior gluteal, internal pudendal, and you have two anastomosis. One is trochanteric anastomosis, one is cruciate anastomosis, and one is the perforating artery, its descending branch, and that's it. So these are all the 7 vessels which are inside the gluteus maximus. Next, let us see what are the nerves inside the gluteus maximus. So if you remove the gluteus maximus, you will see total 8 nerves. One is the superior gluteal nerve. Next is the inferior gluteal nerve. Next is the sciatic nerve. Next is the posterior cutaneous nerve of thigh. Next you will see the nerve to quadratus femoris. Next you will see pudendal nerve. Next you will see nerve to obturator internus. And also perforating cutaneous nerves. Okay, so total 8 nerves. And it's the bones and joints which are inside it, like ilium, ischium, ischial tuberosity, upper end of femur, greater trochanter, sacrum, coccyx, hip joint, sacroiliac joint. So these all are like very simple. You can imagine that. Just remove the gluteus maximus, these all things. So in total, if you see, remove the gluteus maximus, you will see 9 muscles. You will see 7 vessels, you will see 8 nerves, you will see 6 bones and joints, right? Next, you also have some ligaments in bursa, like you have sacrotuberous, sacrospinous, ischiofemoral ligaments. Don't worry, I am saying them in fast because I will explain them later, okay? And also you have bursa like trochanteric bursa of gluteus maximus, bursa over ischial tuberosity, bursa between gluteus maximus and vastus lateralis. So in total you have 3 bursas and 3 ligaments, okay, inside the gluteus maximus muscle. So next we'll move on to the gluteus medius muscle. So you can see the underlined blue color this side. This is the gluteus medius muscle, cut end, right? So gluteus medius muscle is fan shaped and covers the lateral surface of pelvis and the hip. So this is the lateral surface, this is the medial surface, right? So it covers the lateral surface, the gluteal surface of ilium between the anterior and posterior gluteal line. So origin of gluteus medius is from the gluteal surface of ilium between the anterior and posterior gluteal lines. So this one, anterior surface of gluteum, its origin, and it is getting inserted into the greater trochanter of femur on an oblique ridge. If you remember, greater trochanter of femur is present on the anterior side, right there on the ridge on lateral part of anterior surface. So into the greater trochanter of femur on a ridge on and lateral part of anterior surface, there it will go and insert. Okay, so it is supplied by the superior gluteal nerve. So it's very simple, very it's relatable also. Gluteus maximus means it's here, right? As it's here, it's supplied by inferior gluteal nerve. As medius is above, it will be supplied by the superior gluteal nerve. Okay, now we'll check out what are the structures you have cut it. So what are inside the gluteus medius? Okay, so very simple. Inside the gluteus medius you have superior gluteal nerve, you have the deep branch of superior gluteal artery, you have the gluteus minimus, of course you can see here, and also you have the trochanteric bursa of gluteus medius. That's it. So very simple. You'll have the superior gluteal nerve, you have deep branch of superior gluteal artery, you have the gluteus minimus, you have the trochanteric bursa of gluteus medius. That's it. So now we'll discuss about gluteus minimus. Gluteus minimus is also fan shaped. You can see it here, right? It's like a fan, and it is covered by gluteus medius above, right? And it is getting its origin from gluteal surface of ilium between anterior and inferior gluteal line, same like gluteus medius. On the anterior surface of ilium only it will get its origin, and it is getting inserted into greater trochanter of femur on a ridge on lateral part of anterior surface. Same, I think almost like gluteus medius and gluteus lateral minimus have same origin and insertion. In the case of medius, it is inserted in oblique ridge on lateral surface. Okay, there is a ridge running downwards and forwards on the greater trochanter. Whereas in the gluteus minimus, it is getting inserted on a ridge on lateral part of anterior surface. So it is attaching on ridge on lateral part of anterior surface of greater trochanter. So simply, in simple words, you can say medius and minimus both are arising from the ilium and they are getting inserted into the greater trochanter of femur, right? And of course, this is also supplied by the superior gluteal nerve, and its root value is L4, L5, S1. So what would be the structures which are beneath this gluteus minimus? Of course, you have the gluteus minimus include like reflected head of rectus femoris and capsule of hip joint. That's it. So only two structures. No more hangama. Like inside gluteus minimus, you have reflected head of rectus femoris and also you have the capsule of hip joint. That's it. Now let us understand about piriformis. Piriformis is lying below the parallel to posterior border of gluteus medius. You can see gluteus medius posterior border, you have piriformis. Its origin is from pelvis, that is from pelvic surface of middle 3-piece of sacrum and by 3 digitation. So from sacrum it will come and upper margin of greater sciatic notch and adjoining areas of sacroiliac joint and sacrotuberous ligament. So it is having origin from 3 parts mainly, from the pelvic surface, from the greater sciatic notch and from the sacroiliac joint, that is between the ilium and sacrum there is a joint, right? From there, so from there the piriform arises, okay, and it gets inserted into rounded tendon into apex of greater trochanter. So it is getting attached onto the apex of greater trochanter. So it is supplied by the ventral rami. That's it. Next coming to ventral rami and its root value is S1 and S2. Next coming to gemellus superior, you can see here this is small muscle lying along upper border of tendon of obturator internus. It is origin, you can see superior gemelli origin from posterior surface of ischial spine and upper part of lesser sciatic notch. Okay, from posterior surface of ischial spine and upper part of lesser sciatic notch, and it gets inserted into the tendon of obturator internus and gets inserted into medial surface of greater trochanter of femur. So medial surface of greater trochanter of femur. If you see the gluteus minimus, it attaches on lateral part of greater trochanter. You will attach on the medial part of greater trochanter, that is about gemellus superior, and it is supplied by nerve to obturator internus, and its root value is L5, S1 and S2. Next coming to inferior gemellus, it is a small muscle lying along lower border of tendon of obturator internus. It's getting its origin from upper part of ischial tuberosity and lower part of lesser sciatic notch. It is again same inserted into same as like our gemellus superior, like into the medial surface of greater trochanter, right? And it is supplied by nerve to quadratus femoris. So that is the difference. Superior gemella is supplied by nerve to obturator internus. Inferior gemella is supplied by nerve to quadratus femoris. Okay. Next, you can remember it like you can see inferior gemella is somewhat near to quadratus femoris, so it is supplying it. Superior gemella is somewhat like very nearer to obturator internus, so it is supplied by that. Next, coming to obturator internus, it is fan shaped, flattened, belly lies in pelvis, and the tendon is in gluteal region. Okay, it is getting its origin from pelvic surface of obturator membrane, from the pelvic surface of body of ischium, from the ischial tuberosity, from the ischiopubic rami, and the ilium below the pelvic brim, and also from obturator fascia. It will get inserted into tendon of obturator internus, leaves the pelvic through lesser sciatic foramen, it bends at right angle around the lesser sciatic notch, runs laterally inserted into medial surface of greater trochanter. So it will also get inserted finally into medial surface of greater trochanter. It is of course supplied by nerve to obturator internus, right? So in simple words, you can say it is getting its origin from pelvis and getting inserted into medial side of greater trochanter, supplied by nerve to obturator internus. So next discuss about quadratus femoris. So quadratus femoris is a quadrangular muscle between the inferior and inferior gemella and adductor magnus, right? It is getting its origin from upper border of ischial tuberosity. So from the ischial tuberosity, get inserted into quadrate tubercle and area below it. So get inserted into quadrate tubercle on the femur, right? So very simple. Hence the name Quadratus Femoris. Quadratus Femoris. Femoris go and attached to quadrate tubercle on femur. Quadratus because it's a quadrangular shape and it is coming from ischial tuberosity. So what is its nerve supply? It is supplied by, of course, now to Quadratus Femoris, and its root value is L4, L5 and S1. Okay. So now coming to Obturator Externus. This is here. It is a triangular muscle, covers outer surface of anterior wall of pelvis, coming from outer surface of obturator membrane, outer surface of bony margin of obturator foramen. So you can say it's nothing but coming from obturator foramen, right? That is a Obturator Externus, this one. It is getting inserted in a tendon which runs upwards laterally behind neck of femur to reach gluteal region, inserted into trochanteric fossa on medial side of greater trochanter. So simply you can say it is getting attached to the medial side of greater trochanter, supplied by posterior division of obturator now. Okay. Next, coming to last one, tensor fasciae lata. We'll see another diagram. So here you have your tensor fasciae lata, this muscle. Okay, this is getting its origin from outer lip of iliac crest up to the tubercle here. This is iliac crest, outer lip, right? It will get its origin, gets inserted into the iliotibial tract. Okay, below the level of greater trochanter. Here, this white color is the iliotibial tract. So there it will get its insertion, and it is applied by superior gluteal nerve, and its root value is L4, L5, S1. Okay, finally we're done. Even the battery is low. So okay, we are done with this all muscles. So finally we have one extra about our famous muscle, that is our Gluteus Maximus muscle, right? So Gluteus Maximus muscle is having some clinical anatomy. So gluteal muscle clinical anatomy is that intramuscular injections are given at anterior superior quadrant. So how to show you that? So if you see this diagram, you can understand here. This is anterior superior quadrant. So mostly if you want to give any injection, just give it here. Don't give anywhere here, because the sciatic nerve, the superior gluteal nerves, all those may get damaged at this area. So only give the injection over here, okay, this area. So intramuscular injections given in anterior superior quadrant of gluteal region, that is in the gluteus medius and minimus, to avoid injury of large vessels and nerve which pass through lower part of region. So when the gluteus maximus is paralyzed, as in muscular dystrophy, the patient cannot stand up from sitting position without support. So such patients trying to stand up rise gradually, supporting their hands first on legs and then on thighs, and they climb on themselves. So by this you can understand that gluteus maximus is playing very important role for standing and sitting positions. Okay, so when gluteus medius and minimus are paralyzed, the patient also cannot walk normally. He sways or waddles on paralyzed side to clear the opposite foot of ground, and this is known as lurching gait. When bilateral, it is called waddling gait. So if you have this problem of medius and minimus gluteus paralysis on one side, it is called lurching gait. If on two sides, then it is called as waddling gait. And the normal gait depends on the proper adductor mechanism at the both hips. So this mechanism comprises adequate power provided by gluteus medius and minimus, the fulcrum formed by normal relationship of head of femur with acetabulum, and the weight transmitted by head and neck of femur. So normally when the body weight is supported on one limb, the glutea of supported side raise the opposite and unsupported side of pelvis. However, if the abductor mechanism is defective, the unsupported side of pelvis drops, and this is known as a positive Trendelenburg's test. So the test is positive in defects of power, that is paralysis of gluteus medius and minimus. So for example, if the gluteus, if you remove this, you can see here the gluteus medius and the gluteus minimus muscle. So if these muscles are paralyzed, then that is called as Trendelenburg's test, which is positive because the person is not having a normal gait. Okay, so there are defects of fulcrum. It may be either congenital or pathological, dislocation of hip, and defects of weight, that is ununited fracture of neck of femur. Okay, so you can see here different tests we do, like in a Trendelenburg test you can see when both feet are supporting on body weight normally, and you see when only the right foot is supporting the body weight, unsupported side of pelvis is raised by opposite gluteal medius and minimus, like this. Okay, so this is about that. So by this we completed the muscles of gluteal region, which is a very important topic and also very vast topic. So once again, if you revise all the muscles of gluteal region, you know Gluteus Maximus, Medius, Minimus, Piriformis, superior gemelli, inferior gemelli, Obturator Externus, Obturator Internus, Quadratus Femoris. So these are all the different muscles of the gluteal region, right?